I developed my interest in joint replacement way back in the early 90s when I was a senior registrar with Dr. K.T. Dholakia at Bombay Hospital. There we used to observe the surgeries and put the post-operative notes, but it gave us an insight how to do this surgery in a stepwise manner. Then I joined King Edward Memorial Hospital as a lecturer and did a couple of surgeries, but the turning point came into my life when I did one-year fellowship at Wrightington Hospital along with Prof. Mike Roblowski, Professor Peter Kay, and Mr. Bodo Korbach. I learned the step-by-step how to handle the cement, do uncemented hips, as well as to do the knee replacement surgeries. Then there was no looking back. I did a fellowship with Dr. C.S. Ranawat at Lennox Hospital, USA, and learned the nitty-gritties of this surgery and also learned how to do research and publish your research work. Over the periods, I developed an interest to do an infected joint replacement, which is often neglected, how to handle it and how to manage it. And of course, next we developed an interest in handling or doing joint replacement surgery in hemophiliacs. Now, India, with 1.4 billion population and with a growing economy, is going to be the hub of joint replacement surgery. And arthroplasty being the most lucrative branch in orthopedics, many young orthopedists are going to join this branch of orthopedics. But one must remember that in addition to relieving from the pain, it corrects a deformity as well as restores the mobility. But joint replacement implants are not like trauma implants, which needs to be taken out after the fracture is united, but it should remain in vivo. And hence it requires a proper meticulous preoperative planning, then execution of the planning on the table and doing an optimum rehabilitation. Now, one must remember to prevent complications, because if the complication rate is 1% for a surgeon, it is 100% for that particular patient, especially infection. Then one must learn how to prevent and how to handle complications during the post-operative period. Now, another important point to remember that one must not adapt to the new technology which is coming into the market and get influenced by this new technology. Now, history has taught us how metal and metal hips miserably failed after 7 to 8 years. Hence, just observe, then adapt, and then evolve to do a proper joint replacement surgery in order to achieve a good long-term outcome so that the patient will be happy and your expectation as a surgeon and the patient's expectation should match together. Long live Indian Arthroplasty Association. Thank you.